In this session, I am going to do a very interesting and very amazing topic, which is mysterious to some extent, that is the concept of death and how we are going to face the thoughts of death. Now, in this psychology of death, we are going to deal with different topics, such as first trying to understand what is the definition of death, and then going on to understand the concept of death from different perspectives. After that, we will be dealing with the various theories and various issues in understanding the process of death. Apart from that, we will also be doing what is grief and what are the stages of grief, and we will also look in detail about the management of the dying person, and not only that, we will also be dealing with how children face or cope with death. So, today this study of death is actually called as thanatology. To define, thanatology is the study of the phenomena of death and the psychological mechanisms or techniques that help one cope with death. So, to begin with, let us define what is death. If we ask a layperson, they will say that when there is no life existing in the body, then it is called death. So, how do we measure what is no life? So, it is done by first ascertaining whether there is a heartbeat in the person. We check the pulse rate, and then we also see whether there is any kind of breathing. This is called the functional definition of death, which means there is cessation or stopping of the heartbeat and the respiration. But is this enough to understand or to define death? In many cases, it has been found out that this definition of death is not enough, because many times after a person has been declared dead, again there are cases where they have revived, and some of them on the way to the burial ground, and historians narrate tales where there are some people who woke up in their coffins. So, people not only started having fear of death, but they also had started having nightmares about waking up in their coffins and no one to help them. So, in order to, as a response to this, authorities started inserting some bells in the coffins, so that when the dead person regains consciousness, the person can ring a bell and hopefully someone will come and help them. So, today we have a broader definition of death, because thanks to the advancement in medicine, we have state of the art medical equipment which assess and which can catch even minor changes in the body. So, today the definition of death is brain death, that is when there is stopping of the functioning of the brain. So, all the medical authorities, especially in America and other developed nations, they are today adopting what we call as the Uniform Declaration of Death Act. And this Death Act has two phases in that. The first one is cessation of the circulatory and respiratory functions of the body, and the second one is cessation of the activity of the brain, and both these should be irreversible. That is, even after making attempts in reviving the patient, they do not get revived, then only they can be declared as dead. So, how do medical professionals come to a conclusion that there is brain death? They take the help of the recent advances in medicine. With the help of sophisticated equipment such as EEG and PET, they come to understand whether there are any sort of brain waves in the body or not. And you can have a look at the kind of brain waves that can be seen in a dead person in the graph. Here in this graph, it is a representation of the brain activity in the human being, and you can see clearly here on the monitor it will be shown that the pulse rate, the respiration, the blood pressure as well as brain activity are showing a straight line. So, that indicates when all these important parameters of the body show a straight line on the monitors, then it indicates that yes, there is irreversible brain death in the person. So, in spite of the advances in medical science, and today we have these two aspects of death, one is a functional aspect and brain death. In spite of all this, there are some debates that still going on in understanding what is death. For example, if we take the case of a 12-year-old Jewish boy, You can see his photograph in the slide. This boy has been suffering from terminal illness. He had cancer, and the doctors have declared him as dead, but the parents have objected because according to their Jewish laws, religious laws, a person is considered to be dead only if the person's heartbeat has stopped and there is no breathing taking place. Although for this Jewish boy there is no activity in the brain, but however, because with the help of drugs and with help of respirator, his heart is continuing to beat and also lungs are inflating. So, basing on these two criteria, the parents have objected to the medical conclusions, and so by this we understand that medical definition of death is not enough to help us understand what is death. There are many other concepts of death that have an influence on our understanding. For example, the religious tradition that we belong to. Now, medicine stops with the end of life, and it is only religion that speaks after life. So, whether a person has been religious or not, whether that person attended either temple, mosque or church, irrespective of that, after death, that person's body is moved only with the help of religious procedures even as of today, unless and until of course in cases where there is no one to take care of them. So, it is important for us to look into what the major religions speak about concept of death. Going to what Christianity and Islam speaks about death, both of these religious traditions believe that death, after death, now there will be a judgment day and they will be either sent to heaven or hell. Coming to Christianity, after the person left the body, they have elaborate funeral procedures, but in Islam they do not have any kind of such elaborate procedures, and in Christianity they can either bury the dead or cremate the dead, but in Islam they have to bury the dead and they are prohibited from cremating the dead. Coming to other important religions of the world, Hinduism and Buddhism, both of these religions believe in rebirth, and they believe that after death the soul travels to a particular place where, depending on the karma that the person has done, then either he or she is sent either to hell or heaven, and then after the stipulated period of time is over, they come back again and are reborn. However, this is not in the case of those who have self-realized, they are not born again. So, our concept of death, how we understand it, is very much important in the kind of fears that one has about death. Let us look into other concepts of death. Coming to the Mesopotamian concept of death, where they believe that death is an enfeebled form of life. So, you can see in the picture drawing a funeral procession taken by the Mesopotamian people, and in that they believe that those people who have died, they get submerged into the underworld. And there are other concepts of death, when for instance, if we look at tribal beliefs about death, they believe that death is an continuation of life, because they feel that death and life has so much similar, and the journey after death is as complex as the journey while living. And for example, the Dayak community, they believe that after death the soul wanders around and it enters either a mushroom or a fruit near the village, and if a mother takes that mushroom or fruit, then the soul is reborn as a human being, but if an animal eats that, then the soul is reborn as an animal. Like that, other concepts of death are also prevalent. One is that death is continuous process, and others believe that philosophers, for example, who are influenced by Darwin's evolution of species theory, they believe that death is perpetual development, because after death they go into higher forms of life. And one more very important prevalent concept of death is that death is waiting. According to the Western perspective of death is waiting, they believe that after death there is some kind of waiting that the soul takes, and then on the judgment day the soul is decided whether to be sent to the heaven or hell. Coming to the Eastern perspective of death, especially the Hindu perspective, they believe that after death the soul has to wait, say, for a stipulated period of around 12 to 80 days. The soul will be among the loved ones, and then afterwards travel elsewhere, and depending on the karma, the soul is sent either to heaven or hell and again is reborn. So, why is this our concept of death important? It is important because depending on the kind of concept that we have, our fears originate. Our fears of death have been changing over the years. Now, comparatively, today we have more fear of death than earlier, because there is a reason for this. In the earlier times, dying took place at homes. So, we are all exposed to a dying person, and not only that, because there are not many medical advancements during that time, people were dying all throughout the ages, like different developmental stages they were dying, even young children were dying, adolescents were dying. So, death is not confined to old age as it is today in most of the cases. So, people were exposed to dying, they lived with dying, and they were brought up with dying, so they did not have much fear. But today, because death is happening in the hospital setting or in the nursing home setting, we are not exposed so much to a dying person. In fact, there will be many youngsters who have never seen a person die. So, that is why fear of death is on the increase today. And there has been a research study that is done regarding what factors affect our fear of death. And you can see the research results projected on the graph here. And in this graph, you will see that they have done this study on blacks, Mexicans, and also whites. So, they have taken people of different ethnic backgrounds to see if our culture has an impact on the fear of death. And in this graph, you can clearly see that there is not much of a difference in the kind of fears that a person has with respect to culture. But however, the researchers have noted that there are age differences, because you can see clearly that the fear of death is higher in the 50 to 54 age group and highest in 45 to 49 age group, and from then onwards it is on the decline. Usually we feel that it is the elderly who are actually facing death. It is those people who fear death more. But research results consistently showed that that is not the case. Of course, the elderly talk more about death, but it is the middle aged who have more fear of death. Now, there is reasons for this. If suppose we take youngsters, the teenagers, they do not have fear of death as much as the middle aged, because these people feel that they are invulnerable. So, with this sense of feeling, they in fact even engage themselves in risk taking behavior, and they do not have so much fear of death. Coming to the elderly, now they had prepared themselves so much for the upcoming event death, so they also do not fear death so much. But on the other hand, the middle aged people fear death because they have unfinished businesses. That is, they are still at the peak of their activity, probably they had children by that time and they are just beginning to grow up, and so that is why they fear death the most. We have seen how age affects our fear of death, And researchers have also found that our cultural background doesn't really cause any kind of differences in the kind of fear we have about death, but they also tried to see what other factors contribute to our fear of death, and it has been found out that those who are more religious, they do not fear death, and those who are not at all religious, they also do not fear death. Now, what are these fears of death? What are the fears that a dying person has about death? Now, the person has different kinds of fears, like the person feels fear of the unknown because there is this unknown fear about death, and other fears include fears of loneliness. For example, since today death is taking place in the hospital and nursing home settings, the dying patient is usually left alone with very few visitors and only occasionally visited by nurses and the doctors, but they are far away from their loved ones. So, this fear of loneliness has an impact on them, and not only that, they fear that death might occur in an occasion or some place far away from home, for example, in the case of accidents or untimely deaths. So, fear of loneliness is a part of death. Other fears that people have regarding death is the kind of sorrow that is involved. Thoughts about our own death lead to sorrow, and also thoughts about other important people in our lives, that also leads to lot of sorrow, because what will happen to the loved ones after the person has deceased, and how this person is going to cope up, say after the death of their parents or after the death of the spouse, or for example if there is the death of the child. So, death has lot of sorrow in it. So, people fear this sorrow. And other fears that people have include fear of losing control of the mind, because today death is happening in the elderly more, because thanks to the technological and medical advancements, today people are living to their ripe old age. But what is happening is their body is degenerating, and so we find many people losing their brain functioning, many suffering from dementia, and many suffering from Parkinson's disease and so many other disorders. And especially if there is someone in the family, say a father or an uncle who has suffered from these diseases or disorders, there is intense fear in the person that they also might lose their senses and one day become like their parents or the uncle whom they have seen suffering from these disorders. So, this fear of losing control is another important fear associated with death. Now, not only brain control or cognitive control, but also fear of losing physical control, because during death, when those last stages arrive, then many people lose control of many of their functioning. They cannot speak properly, they cannot move even their hands and legs many times, and they cannot even go and to the bathroom on their own. So, they have this fear of losing control of themselves, and these people might have led all throughout a very successful life where they have never depended on others and where these people were always in charge. But even such people during the time of death, there is a chance that they have to be dependent on others. So, the fears also originate because of this kind of dependence that is required for many of them during the process of death. So, people also have a fear that they will regress. What is this fear of regression? They have the fear that they will no longer be able to have a sense of control of their body and mind, and not only that, they will regress to an earlier stage, that is their childhood. So, that they have fear that they will become highly dependent on others and that they will not be capable of doing any activities on their own. And other very important and most common fear is fear of pain and suffering. Now, all of us know that death is not an easy thing. Of course, there are some people who are lucky enough to die in their sleep, and all of us fantasize such a death. But unfortunately, death involves lots of pain and suffering. And so people have this fear, intense fear, that what kind of suffering they have to go through before they die. So this fear about the pain of death, because mostly they die after suffering prolonged period of time, they suffer from many diseases, many complications arise. They might be suffering from terminal diseases like heart disease or cancer, or even many other diseases like complications coming out of diabetes. So all these things involve lot of pain and also suffering. And today we see that many people undergo a long period of suffering before they die. So understanding what our fears of death are and trying to identify our fears of death and noting them down will give us an opportunity to deal with these fears and be well prepared before the time of death. So let us see how to cope with these thoughts of death. In this, these Buddhists have suggested the 5 powers of death, and they say that the first one is power of purity, where one has to purify all the negative actions and they have to give up attachment to all possessions. And the second one is power of intention, where a strong mind power needs to be developed and positive resolutions have to be taken up so that they will not be disturbed or under the influence of negative disturbing emotions. And they also suggest that the power of remorse has to be built up by the person, where remembering the disadvantages of the disturbing emotions happens and where they can make attempts to protect oneself from being overwhelmed by them. They also suggest the power of prayer to overcome fears of death, where they make strong prayers for a happy death and also the travel thereafter. And finally, they suggest the power of familiarity, where they say that one has to utilize whatever difficulties one faces at the time of death to reflect on the religious teachings and also to meditate on the emptiness of true existence of all things. So these 5 powers help the person cope with the fears of death. And today these Buddhistic teachings have lot of influence on psychologists and also on many death professionals, and they try to encourage the dying patients to develop them. Apart from that, there are certain other techniques to help people cope with death, and one of that technique is preparing one's own obituary. They suggest to make elaborate preparation of one's own obituary so that the person is emotionally and cognitively prepared for death, which is inevitable. And another techniques that they suggest is trying to be in a relaxed state of mind and then meditative. In that meditative state, they suggest one has to just look at what happens when they die, fantasize what happens when they die. So go through that exercise of imagining one's own death and looking at one's own dead body from outside and also imagining what will happen afterwards. So when once continuously undergo these exercises, probably the first time they will have lot of fear surfacing, but gradually they can slowly overcome these fears of death. One more exercise that is suggested is trying to see the final scenarios, that is going into details about their death. They can think about how the death ceremony can be conducted, and also preparing important things like wills and all that. And apart from that, they can also make elaborate preparations for the final travel. Like they can ask their friends and relatives where they have to be buried. So, thinking about all these things that will happen to their body after death also helps the person to face death. So, in this session we have seen what is death and what are the different definitions of death, and we have also seen what are the various concepts that we have regarding death. And this is very important for us to understand where we stand and what our fears of death are, and we have also seen certain mechanisms in that help us in overcoming our fears of death.